Jai Jagannath. A warm good morning to the esteemed dignitaries on the dais and of the dais, and all ladies and gentlemen. I am Mr. Rasmiranjan Sahu, representing Roland Institute of Pharmaceutical Sciences on this Youth Leadership Conference on the event of Youth Pharma Festival 2024. So the topic for today is Odisha Vision 2036 and Viksit Bharat 2047 concerning to health and pharmaceutical care. So first of all, we have to know why our vision for these 2 years. As I am an Odia, I can proudly say that Odisha is the first language-based state established in India on the year of 1936. And 2036 is the 100-year milestone to it. And Viksit Bharat 2047 is the vision of our Honorable Prime Minister on the event of 75th Independence Day, and he also gives Panch Pran to develop our India. But today, here we have to discuss in this Youth Summit about the role of youth, the vision of our youth mind for next 20 to 25 years to develop our country, to develop our state on the sector of pharmacy, on the sector of healthcare. First of all, as I belongs to pharmacy fraternity, I can proudly say that the pharmacy of the world is India. India is the significant global supplier of affordable medicines, therapeutics, vaccines. As in the previous conference, our dignitary said that the 45% of generic medicines demand fulfilled in United States of America by India. The next thing is, our Odisha is also in the front line. As you have seen in your town about the hoarding, about the advertisement of that more than 1 lakh people in every month are getting benefited by more than 200 crore with Biju Swasthya Kalyan Yojana. But my question to you all, that really we are in the prime condition of healthcare system? No. I will say about the dark truth behind the Indian healthcare system. Because without knowing the problem, we can't go for the solution, we can't go for the vision. As we are celebrating 75th Independence Day, Azadi Ka Amrit Mahotsav, but still we don't have right to health. As a citizen of India, we have right to speak, we have right to vote, we have right to education, but we have no right to health. India is now the 5th largest economy of the world, but unfortunately, we don't have an efficient healthcare system. It is not the word of my mind, but the report said that insufficient allocation of healthcare system in India pushes 7% Indians below poverty line and 23% people cannot afford the hospital bills. Then you might have questioned that we have Ayushman Bharat, we have Biju Swasthya Kalyan Yojana, then why this crisis? Because the Indian healthcare system is now a business model. Suppose any one of you suffer from a disease. First of all, you go to the government hospital, and you all know about the treatment of our India's government hospital. In the maximum cases, the government hospital refers the patient to the private hospitals, where the businessmen are treating you more than a doctor. Where you might get a good treatment, but most get a good bill. Where for every normal disease you have to go for a surgery, and every pregnant woman go for the C-section. Where they charges 20 rupees for a 2 rupees of syringe. Then you might think about the treatment in private hospitals. According to report, 55 million people of India are pushed below poverty line because any one of their family are with a severe disease. And 380,000 people attempted suicide because they cannot afford the hospital bills. In India, there is 69,425 number of hospital, from which 45,232 are private hospital and only 25,000 are government hospital. The 62% people of India are now emphasizes on private hospitals. But the thing is, according to WHO, there must be one doctor for 1,000 people, but in India, there is for 2,325 people, there is only one doctor. So in rural areas, you can see that many people with fake licenses, fake medical certificate are serving people and pushes them to death. As we are vision for 2047 Viksit Bharat, but the most disappointing thing is that in India, we are spent just 1% of our GDP on health sector. Whereas the other developed countries are spending more than 10% of their GDP. So that our government gets so more taxes from the private investment, so they focus on the life insurance or health insurance, just like Ayushman Bharat, BSKY, not on the government hospital opening. And the next thing is, as you know, the private hospitals come, but the more dangerous scam in Indian pharmaceutical industry is the pharmacy scam. I will elaborate the pharmacy scam. When you are suffer from a disease and go to government hospitals, you get a prescription, and after 2 to 3 hours standing on a line, you just get 2 to 3 number of medicine, not all, because in government hospital they only provide the generic medicines. Then you might question why we don't get all the medicines, because the person whom you think the second god, your doctor, forces you to buy the branded medicine, because for prescribing branded medicines they get percentage, they get benefits. The store pharmacist, the doctor, the pharmaceutical company, also when they lost their patent on the branded medicine, they just change the component or adding some salt and make them as brand and market it on the human populations. So they get more benefits. The next scam is pathology scam. When you go for a private hospital, for no reason, they prescribe some tests, and when you go for the test, the pathologist take your sample and just throw it to the dustbin, nothing to test. That is known as sink testing. And by sink testing, they just give you a good report where you are satisfied. So I think you might know about might be able to understand about the scam that is in India about pharmacy and health sector. So what is our vision? As the India is now the leading of youth, 50% of India is youth India. So we youth, we have to express our thought, we have to raise so that we can change the India. So my vision for 2036 India and Viksit Bharat 2047 is, first, aware people about generic medicines. There is no difference between branded medicine and generic medicines, but there is our mindset. We have to change our mindset. As you think that 25% of the demand, the 45% of the demand of US and UK are fulfilled by our generic medicines, then why not our people use generic medicines? And also the strict rule from the government to prescribe only for the government doctor to prescribe only generic medicines. The next is efficient healthcare system for India. Now in India, there is lack of government hospitals. So our government should focus on opening government hospital, not in the health insurance. The next thing is,
your time is too short. Please complete.
The next thing is change in pharmacy courses. We have to apply skill development. We have to apply digital healthcare in our pharmacy curriculum so that our pharmacists can be skilled, so that in future, if there is some conditions like COVID, our pharmacists can serve the mankind. The fourth thing is, we have to use at least 5% of our GDP for the health sector, because being health and make your country health. The next for our Odisha is, in our Odisha, there is more than 60 number of pharmacy institution from where you belongs to. But our students after graduating go to the Goa, go to the Sikkim, go to Hyderabad for 18,000, 20,000 job. So our government should about to open more number of pharmacy manufacturing in Odisha. We have to make Odisha as the pharmacy hub, as IT hub recently. When we become a pharmacy hub Odisha, we can develop our Odisha and our India. And the last thing, as a youth, you have to develop your mentality and make right of the health. Thank you. Jai Jagannath. Vande Utkal Janani.
आउटस्टैंडिंग रश्मि, बहुत ही सुंदर था आपका जो ये अभिभाषण था। भारत विजन को लेके जो आपका वर्ड्स है, जो आपके अभिभाषण थे, बहुत ही सुंदर थे एंड बहुत ही क्लियर थे। सो ऑल द बेस्ट फॉर योर ब्राइट फ्यूचर एंड सभी से उम्मीद रहेगी कि ज़रूर रश्मि से इंस्पायर हो। कल भी मैंने रश्मि को देखा था, वो कॉन्स्टेंटली जितने भी हमारे स्पीकर्स थे वो सभी को सुन रहे थे। ये बहुत ही अच्छी बात है एक लीडर होने के लिए। सो आप में वो सभी गुण हैं। कॉन्ग्रेचुलेशन एंड थैंक यू सो मच फॉर दिस आउटस्टैंडिंग स्पीच। सो हमारे साथ हमारे